came in ENT OPD with chief complaints of swelling in lower anterior neck since 2 years. History of presenting illness. Patient was apparently well 2 years back. When she noticed this swelling in front of the neck, it was insidious in onset. Initially, swelling was initially small in size and gradually progressed to present size of 2.5 into 1.5 centimeter. The swelling is not associated with pain. She had no dyspnea, dysphagia, hoarseness, and stridor. She has no symptoms suggestive of hypothyroidism or hyperthyroidism. She gives no history of other similar swellings in the neck, cough, or any other bony pains.
Okay. So, Dr. Sabha, I would like to stop you over here.
Okay.
You told that she is a homemaker by profession and resident of Barwala. So, is there any importance of residence, like the patient belong to which place or what occupation is he doing? Is he or her doing any importance?
Sir, in case of residence, if the actually iodine deficiency areas are there in the areas where the in the food there is a deficiency of iodine.
Okay. So where are those areas in India?
Sir, hilly areas.
Hills तो बहुत सारे इंडिया में. कौन से hills?
Okay, sir.
So you can take specific names of
Himalayan belt.
Himalayan belt, Gorakhpur, Bihar region. That in that case it's sub Himalayan belt, right?
Ratnagiri.
Ratnagiri belt. So over here, two things extra. Also, you know that there are few belts in Kerala which are very rich in thorium. Okay, so two things are there. Second, anything related to profession? Yeah, in other words, I'll frame any
environments like CT.
Any person who is working in
Radiation exposure.
Radiation exposure. And
so from radiation exposure, which type of thyroid malignancy occurs?
Papillary thyroid occurs.
Okay, so remember this thing that due to exposure of radiation, PAPCA can occur. From iodine deficiency, follicular malignancy, follicular carcinoma can occur. Okay. Then you told about in your presenting complaints that there are no symptoms suggestive of hypo or hyperthyroidism. Would you like to explain something like few symptoms? What are hypo? What are hyper?
So there is no history of intolerance to cold and intolerance to heat. There is no history of loss of weight or gain of weight. There is no history of facial puffiness. There is no history of tremors, palpitations. There is no history of mental confusion.
So, what my suggestion is there, like once you take your entire case, you will come to know that in how much time you will be able to finish it. Okay. So if it's like that, your history and examination is very compact, very comprehensive, then you can direct, instead of like saying like this, she gives no history of suggestive of hypo or hyper, you can mention around 3-4 points of hypo and 3-4 points of hyperthyroidism. Okay. So this will give you some time. Then it shouldn't happen na ki you start your case and within 2 minutes you say sir summary pahunch gaya. So that also gives a very good impression. And if it's like you have that content in your history in examination, so then you can go with whatever you have already suggested, like already written. So in this case, as soon as the examiner asks you what is the history suggestive of hypo or hyper, so then you can like utter whatever you have learned. The above point that no dyspnea, dysphagia, what is the importance of this, relevance of this?
So pressure symptoms due to thyroid swelling.
Retrosternal extension, right?
Retrosternal extension.
Symptoms and retrosternal extension will be important in this scenario. Okay, move to the next slide.
Okay. Coming on to past history, no known medical comorbidities, no previous surgeries in the neck, no history of radiation in the past, no history of any drug intake in the past.
Okay. So, history of radiation you have taken, history of drug intake. What kind of drugs do you want to ask?
So, anti-thyroid drugs, drugs for hypothyroidism and hyperthyroidism.
Okay.
Also anti-psychiatric drugs, no sir?
Anti-psychiatric drugs.
Okay, what is the importance of anti-psychiatric drugs?
Sir, in patients who have suffering from bipolar disorder and the patient who are on lithium can cause hypothyroidism.
Okay. So, come to the menstrual history.
Menstrual history, she attained menarche at the age of 15 years. She has regular cycles of 28 days.
Any importance of menstrual history?
Sir, in case of hypothyroidism, the onset of menstruation or menarche becomes late, and there will be irregular periods and irregular cycles of the menstrual cycle. And
Aji, log in kijiye. What's the importance of menstrual history?
Sir, in case of hyperthyroidism or hyperthyroidism, the patient can have amenorrhea or irregular cycles.
Okay, good. Now, in personal history, anything significant?
No, sir, it's not significant.
Nothing significant. What are you looking at? Like, in like specifically, any point are you looking at?
In personal history,
In diet, में कोई anything you are looking in diet?
sir, consumption of cabbage, consumption of spinach, consumption of turnip and
So what is the name, scientific name for all these?
Brassica family.
Brassica family. These are all the
Brassica
goitrous
family.
ones. Okay. And you may also mention history of persistent diarrhea. Okay. So why is this persistent diarrhea important? What does it signify? It signifies medullary carcinoma of thyroid.
Medullary thyroid carcinoma.
It's a characteristic point for medullary carcinoma of thyroid. Okay. So moving ahead to the GPE. Okay. So
patient is calm, conscious, cooperative, and well oriented to time, place, and person. Her palms are dry and there are no tremors. There is no pallor, icterus, cyanosis, clubbing, lymphadenopathy, or pedal edema. Her pulse rate is 78 beats per minute with good volume and regular rhythm in the right radial artery. Her BP is 130/70 in right arm in sitting position. Her respiratory rate is 16 cycles per minute. Her temperature is 98.6 degrees Fahrenheit.
So in the general physical examination, again your hyperthyroidism and hypothyroidism features will play a role. ठीक है? So read them properly.
यहाँ भी सर वो सारे features लिखने हैं या?
No. You don't have to write everything again and again. One place you should mention. You should be ready for such questions. है ना? He might ask you कि what is the importance. So then you should not I'll say don't get stuck. है ना? You should be ready कि मतलब bradycardia किसमें है, in which the temperature intolerance to cold कहाँ पे आ रहा है, intolerance to heat कहाँ पे आ रहा है. ठीक है.
Sir, do we have to write skin examination, eyebrow examination, ये सब लिखना है इसमें लोकल में?
देखो वो मेंशन तो आपको करना है, आई एग्जामिनेशन मेंशन करना है. इट्स अप टू यू हाउ यू हैव टेकन. You can either mention in the general physical examination or after completion of your thyroid examination you can mention the eye signs over there.
आगे किया होगा.
ठीक है, तो आप यहाँ पे भी मेंशन कर सकते हैं. Be ready for the eye questions over here. कि what are the named signs seen in the eyes, है ना? So remember at least 3-4 of them. रट्टा मार के बैठ जाओ. ठीक है, because the problem which happens कि all these signs are having very absurd names. So if you try to remember them in front of the examiner, definitely you will make some or the other mistake. So learn 3-4 of them. That should be enough, and that will tell the examiner कि हाँ इसको आता है कि what are the signs of thyrotoxicosis. ये तो अपने 3-4 signs you have टक बता दिए, काम खत्म. ठीक
है. Coming on to local examination.
एक मिनट.
Coming on to local examination done in sitting position in a well-illuminated room. On inspection, there is a single swelling in anterior lower part of the neck, more on the right side, which moves with deglutition. It measures 2.5 into 1.5 centimeter approximately and is ovoid in shape. It extends superiorly from thyroid notch up to 2 centimeter above the suprasternal notch and laterally 1 centimeter away from the posterior border of the right sternocleidomastoid. The lower border is palpable. The surface appears to be smooth. There are no other swellings in the neck, no obvious pulsations visible, and trachea appears to be in central position.
So I would like to stop you over here at the inspection. Okay. So you told about the swelling that you are able to see. Supposedly that this swelling of thyroid is very small. So is there any method to improve this visualization of this thyroid?
Sir, Pizzillo method.
What is this method?
Sir, we will ask the patient to move his hands towards the back of the hand at the occiput, and the patient is asked to put his head on the hand at the occiput.
Okay, so it's correct that you extend the neck and apply pressure from behind by your folded hands. So because of this, small swelling will become more prominent. Remember this method. This might be asked that what is the importance of it. Okay, so you told this does this swelling moves up on deglutition?
Yes, sir.
Do you know any other swelling which moves up on deglutition?
Sir, thyroglossal duct cyst.
Okay.
And external laryngocele.
Laryngocele, ectopic thyroid. These will move up on deglutition. What are the swellings that move with tongue protrusion?
Sir, again it is thyroglossal duct cyst.
Okay. What is the commonest position of this thyroglossal cyst?
Sir, subhyoid.
Subhyoid. What is the name of surgery that you do for this?
Cyst trunk operation, sir.
Cyst trunk. So remember this cyst trunk operation, what all you remove. Then the next question will come, what is the precautions that you will take or what are extra steps you will take to prevent its recurrence. In the other words, they want to ask what is modified fish trunk operation. Okay.
So,
And
we remove the part of the hyoid bone along with the
that you have mentioned, cuff of the muscle, part of hyoid bone, that you have to remove. Okay. And the two things are there. Got it. What do you mean by Berry's sign? Do you know?
Sir, in case of Barry's sign, carotid pulsations become feeble.
Okay, good. And why do they become feeble? Or in other words, like
Because
in
of
which
the
cases will it be
posterior
positive?
extension. Because of the posterior extension of the carotid sheet with the swelling.
No. Again, repeat what you said. Because of?
Sir, posterior extension of the sir, नहीं.
अच्छा अब सुनो, कैरोटिड किधर होती है? These are lateral or posterior to thyroid? Laterally होती है ना?
Yes, sir. Yes, sir.
So normally what happens in Berry's sign that there is malignant infiltration from the nodules. So how will it go? It will go laterally only, na?
Yes.
So what happens ki when it goes and causes some obscuration in the carotid infiltration is there, because of them this carotid is feeble, becomes feeble. So this is called as Berry's sign. Okay, this is seen in examination. Now there is one more examination sign by the name of scabbard trachea. Have you heard this name? Scabbard trachea? You might pronounce it by another means. So two questions over here. First is, what is the meaning of word scabbard? And then we'll come to this point ki what is scabbard trachea, where is it seen, all those things.
Compressed.
Sir, scabbard sandwiching of the trachea between the.
Before going to ENT, normal meaning of word scabbard.
Scabbard is just a sheath of the sword.
Sheath of the sword.
ठीक है, तो you would have seen those people going to fight with a sword. हिंदी में जो म्यान बोलते हैं, that place in which you keep your sword, है ना, metallic part of the sword. So that thing is, how is it? It is it is elongated from front to back, okay, and narrow from side to side. So that's why the sword will go inside. Similar thing happens with the trachea. Okay, similar thing happens with the trachea, that this trachea becomes narrow from side to side and it is elongated from front to back. That is in the sagittal section. So what happens ki they'll ask you ki in which cases scabbard trachea is common. So ENT scenario mein retrosternal goiter is very one common DD, and if they ask what extra, so you can answer COPD also. ठीक है? If they ask even extra ki how will you evaluate this thing, so you can go for a CT, you can go for a bronchoscopy to rule out this. अगर रेट्रोस्टर्नल गोइटर हम अपना सोच रहे हैं तो सीटी करेंगे, सीओपीडी वगैरह है तो ब्रोंकोस्कोपी वगैरह, लाइक इट गोज इनटू द अदर डोमेन. वो हमारा नहीं, जस्ट रिमेंबर दिस थिंग नेम. ठीक है, सो यू हैव टोल्ड दिस थिंग एनी. ठीक है, एनी अदर इंस्पेक्टरी थिंग वुड यू लाइक टू सी? नो. Move to palpation.
On palpation, there is non-tender solitary swelling in front of the neck extending to right side, which moves with deglutition. It measures 2.5 into 1.5 centimeter and is ovoid in shape with regular margins. Swelling is firm to soft in consistency. Overlying skin temperature is normal. Overlying skin is free, not tethered, and is mobile. There are no palpable cervical lymph nodes in the neck. Carotid pulsations are palpable bilaterally. The trachea is central in position.
अच्छा, इसमें two things I would like to modify. I'll not say correct. This is also correct. First thing is, what test do you do for seeing retrosternal extension of goiter? What is the name of that? Pemberton. This is theory. ठीक है, तो remember the image of Pemberton sign. This can come as OSCE also. Yes. Now, one thing, whenever you start palpation, this is a very good habit to start the case. Ki, sir, the findings of inspection were confirmed on palpation. One. Okay. Then you go, as Dr. said, ki, what is the temperature of the skin that you are feeling? Two. Number three. Now you have said ki this size of this swelling is 2.5 into 1.5 centimeter. So you can also put it ki what is the extension of this swelling in, like I'll say, relation to the normal anatomical structure. Okay. Example, like your thyroid gland mein aap superiorly jaoge to you will have hyoid bone. Laterally, you will be having sternocleidomastoid, and niche inferiorly, you will be having the suprasternal notch. Okay. So it is a good habit to mention the swelling. Like example, if I were to mention this thing, like if there is a bigger swelling, so I'll say, sir, this is say this into this centimeter swelling, extending 2 centimeter or 2 fingers below the hyoid bone, extending 1 centimeter, 2 centimeter before the or lateral to the medial to the sternocleidomastoid, or itna centimeter above the suprasternal notch. So this gives the extension in a more scientific presentation. Okay, there is no ratification in that. Just imagine, and in relation to the swelling of like that you get in the exam, you can put it in. ऊपर से कितना है, laterally कितना जा रहा है, नीचे से कितना ऊपर है, ठीक है, तो it will give a good thing. Okay, swelling is firm to soft, you have told, overlying temperature you told, skin is free and mobile, ठीक है, lymph node also you have told here, carotid pulsations are palpable bilaterally, trachea is central in position. Okay, so all three questions we saw in the earlier slide only. ठीक है, palpation of thyroid में, do you know any names, sign like methods for palpation?
Leahy's method, sir.
Leahy's method and Kreil's method. ठीक है,
Kreil's
so both of them please read about it. Don't get confused on the exam day. ठीक है, Pizilo की जगह Leahy बोल रहे हो, Leahy की जगह Kreil's. It should not happen. There are like three named methods over here. In spectri में this is Pizzilo's. ठीक है, on palpation this is Leahy's and Kreil's. Okay, and there is one more named thing, that is Pemberton's. So these are the four named things that you have to remember. Don't get confused for it on the day of exam. This is important. ठीक है. So, like anything you want to tell in auscultation and percussion? Anything important over it?
Nothing, sir. It is normal. There is no audible bruit or palpable thrill at the upper pole of the swelling. There was a dull, not hard.
Eye signs. Will not bore you. Eye signs में, yeah. What are the eye signs that you know of in thyrotoxicosis?
Sir, I know von Graffi sign. It is basically upper eyelid lags behind the eyeball.
ठीक है.
And Joffre sign is absence of wrinkling of the forehead.
ठीक है. Anything else?
Stalbeck sign. It is a sir staring. It's just like a staring look.
Staring look.
Mobius sign is inability to converge the eyeball.
ठीक है, ठीक है. So remember these 4-5 signs. ठीक है, remember these 4-5 signs, and then examiner might test your knowledge. एक और बताओ, एक और बताओ, एक और बताओ. So then you can put in, but at least 4 you should utter in one go without stopping. ठीक है? Chalo, that is good. You have reached till now, and now you have reached the examination of oral cavity. Like, is there anything significant over here?
No, sir, nothing significant. All examination is normal.
If you get this thing as a long case, mention everything. ठीक है?
Okay, sir.
उम्मीद सर कुछ कह रहे हैं आप?
हाँ, I was thinking कि ये palpation में corpus sign आजकल बताते हैं नहीं बताते हैं?
सर मतलब बोलना it's always better, है ना? Otherwise like you should know if examiner asks you कि what is it, तो definitely बोल सकते हैं करके. There's no harm in telling sir. ठीक है सर, है ना? So anything in systemic, no significant, so we'll just take the provisional.
Yes.
ठीक है. हाँ, तो like how will you go for the diagnosis?
Sir, as my patient is a 35 years old lady with a solitary, so I will go for radiological investigation, that is
रुक जाओ. अल्ट्रासाउंड में कूदने से पहले you said probably benign. So why do you say it is benign? Or rather, I'll reframe the question. What are the signs of malignancy in the swelling? How will you suspect the malignant?
Sir, I didn't get your question.
Okay, I'll repeat it. How, like
size more than 4 centimeters?
Yes.
Okay, so the margins will be rough.
Air compression.
बिल्कुल. ठीक है. Any pain, tenderness of swelling. Okay.
Yes.
So
hard swelling.
Sudden increase in size.
Remember.
Fixity.
Sudden increase in size, fixity to the skin. ठीक है. Infiltration of the skin, size, all these three things. अच्छा, from here only I'll share it in nodal status also. ठीक है. So all these things will indicate towards the malignancy. इसमें guys please read the ATA guidelines. If somebody has the latest one, please share on the group. Otherwise I'll check and post it on the group. This is important. People will ask you ATA guidelines on this. Okay. So Dr. Sam, after that, how will you like to proceed? Suppose you have passed your exam, you are practicing, and patient comes to you, like same patient comes to you, come back to you for treatment. Now, like, how will you proceed with the case?
Sir, in our institution, if any case of such case comes in the OPD, we'll follow. We prescribe the patient 3 tests at one go. That is ultrasound of the neck, FNAC of the swelling, and thyroid function tests.
Acha, would you like to again reframe your answer? You are correct, but you have to reframe it.
Okay. I will go for thyroid function test first.
Yes, ठीक है. तो सबसे पहले blood test है. The 5th thyroid function test. Now another question. If you have only one thyroid function test to do, what will you do?
Sir, TSH.
TSH करेंगे. ठीक है. उसके बाद अगला next step will be your ultrasound. Why do you want to do ultrasound?
Sir, to see the
to stratify the swelling, whether we will do a FNAC or not.
Exactly. So basically the thyroid rating that we get, So it indicates generally the main motive of it is ki whether to do FNAC or not. Okay, but generally what happens ki in order to like that the patient should not come back again and again and again, we generally go ahead and like do all these things in one single go. Patient will get his thyroid profile done, then go for ultrasound, and then go for FNAC and come back to us. Okay, so as Dr. rightly said, another question will come to you: what is the full form of ACR thyroids, and what do you want to look in ACR thyroids?
Thyroid imaging reporting and data system.
And ACR?
American College of Radiology.
American College of.
ठीक है, तो full form you have to remember. I was asked this thing in my exam. ठीक है.
Sir, American College of R से क्या होगा sir?
Radiology होगा भाई, और क्या होगा?
Radiology. Okay sir.
ठीक है, and thyroids. So remember what are the thyroid trading, है ना? That is important. In what is to be done? That you have, all of you guys, please rectify this thyroid table. Rectify this Bethesda table. ठीक है, you won't be able to remember it on the day of exam, on the day of viva, if you have not learnt it by heart till now. ठीक है, so still if like we have 3-4 days, please remember it. It is very important. Now in thyroids, what features are important to you, doctor? Why, like what will suggest कि malignancy हो सकता है इसका?
Sir, composition of the swelling, that is cystic, solid or mixed. Echogenicity, the swelling can whether it is echogenic, hypoechoic, anechoic, or very hypoechoic or hyperechoic. Shape is wider than tall, taller than wide.
ठीक है. What is the percentage? ठीक है, you are right. ठीक है, you remember it. What is the, now 2 questions from the ATA guidelines. What is the percentage of malignancy in the polycystic nodule? Sorry, it's a rectification question, but पूछते हैं. What is the percentage of? हाँ, good, very good. ठीक है. Now next question. Suppose you are getting these cystic nodules. How will you come to know that these are malignant or these are bad? Like what are, in other words, what are the ultrasound features of the cystic nodules which are supposedly bad? There are 3 features.
Sir, when it is.
I'll repeat the question. Ashish, एक minute. Question needs to be repeated. That you are getting cystic nodules on ultrasound. Okay. So how will you come to know whether these cystic nodules are bad? What are the features of, I'll say, malignancy or like sinister features for the cystic nodules? So there are 3 features which you have to utter. First is
when it is eccentric solid component, when it has an acute angle with the cyst wall, and when it is microcalcification.
ठीक है, so these are as per the ATA guidelines. ठीक है, remember this point, guys. I have shared 2 links of the videos. One is of the AOI हरियाणा वाला जो है, that is the most basic. ठीक है, वो bare minimum है, that you have to know for passing. ठीक है, उसके बाद second वाला जो TMC वाला जो है, that is the super specialization वाला है, that is by Dr. पूनम जोशी मैम, टाटा मेमोरियल का. That is one level up. So their whole viva starts with the ATA guidelines and in the BTA guidelines. So once you finish the initial one, then go for the second one. If you feel like want to take your preparation to another level, don't start with the second one first. ठीक है, these questions are from the TMC viva only. ठीक है, तो remember this ATA guidelines and like you have already said. Now second question will come is, I'm asking from the same presentation, what is the like percentage of malignancy in a pediatric nodule, a pediatric patient with thyroid nodule? Percentage
50%.
50%. ठीक है, तो these 4 questions please छाप लो दिमाग में. If examiner asks you and you quote कि sir I'm telling from ATA guidelines, 50% ठक से यहीं से only you'll cross your 50% marks. ठीक है, so you did the thyroids for the patient. Supposedly thyroids come 4, TR4 है. अभी what you will tell patient? Now what to do?
Sir, adult में percentage कितना था sir?
हाँ, sorry I didn't get. What are you saying? Thyroid 4 है, चलो 4 पकड़ लो. हाँ.
Sir, in thyroid 4 we'll go for hemithyroidectomy.
Sir, adult
नहीं, patient को क्या advise करेगा? हाँ, sir, एक मिनट. Dr. Vaishak, what are you saying?
Sir, what was the percentage of malignancy in adults, sir? Adult में कितना percentage था?
3 questions हैं. These are all framed questions. I have not taken it from my side. These are the viva questions. ठीक है. So first question which was कि what are the chances or what are the features of malignancy in the cystic nodules that you get on ultrasound. So there were 3. First is malignant. I'll put it on group. Don't worry. मैं PDF डाल दूंगा. First is malignant. That is the क्या कहते हैं? Eccentric with the solid ये. second is acute angle with the cyst wall, and third is microcalcification. And the percentage of malignancy is generally 1 to 3%, around less than 4% बोल सकते हैं. And second question will be कि pediatric patient with nodule, what is the percentage of malignancy? This is 50%. ठीक है? Okay. So Dr. Ashish, you did USG, तो thyroid 4 आ गया. अभी क्या करोगे patient के लिए?
Sir, we'll go for surgical management of
अरे FNAC करोगे पहले.
FNAC.
ठीक है, FNAC करेंगे. ठीक है, don't forget, है ना? These are the like step by step you have to go. After this, we will land up in thyroidectomy. ठीक है?
Yes.
So FNAC में what is the name of the criteria that we follow?
Sir, Bethesda grading system.
Bethesda grading. ठीक है, please rectify Bethesda. I'll not bore you up with Bethesda over here, but please remember Bethesda. Its rating will tell you what is the percentage of malignancy that can occur in the patient. So that accordingly you have to counsel the patient. कि this is the percentage of malignancy if you don't undergo surgery. Okay. Now suppose Bethesda भी 4 आ गया या Bethesda 3 आ गया and patient is willing for surgery. Now what will you plan for patient?
Sir, hemithyroidectomy.
Hemithyroidectomy, right side. ठीक है. How will you counsel the patient for hemithyroidectomy?
Sir, counseling part, sir, वो आपको बताना पड़ेगा सर मुझे.
अरे तो अभी एग्जाम तुम्हारा है ना, ट्राई करो. परसों आ गया क्वेश्चन, अभी क्या बताओगे? सोचो, पूछ के बताओ. वी हैव ऑल द टाइम इन द वर्ल्ड. हाफ एन आवर तो है ही अभी अपने पास.
Yes,
not
yes.
20 minutes है.
Sir,
पूछ के बताओ. No, not an issue.
We'll explain the procedure to the patient, and we will tell him or her all the possible complication related to the surgery.
So
And
what
we'll counsel-
complications will you tell the patient?
Sir, about recurrent laryngeal nerve palsy.
Okay, good. How will it affect the patient?
The patient
She will have hoarseness of voice.
Hoarseness of the voice.
ठीक है. ठीक.
Yes.
Any other feature that you would like to tell her?
Do under general anesthesia.
ठीक है. So you
next
tell us
car,
about next scar है ना. In the females you have to tell about neck incision. Start from the neck incision.
The
Then
weakness
you
of
go.
voice due to superior laryngeal nerve palsy.
Yes. ठीक है. So that the examiner will ask you like how the SLN palsy matters. So moreover, like in a housewife, it might not matter her much, but in a person with professional voice, all these things are also to be mentioned. Then you have to counsel her regarding hypocalcemia. You have to counsel her regarding the reduced thyroid hormone status. She might be put on thyroid supplementation also. Okay, all
Okay,
these things have to be counseled to the patient. Okay. So you have this is ठीक है. So ये this is हाँ सब and yes, Dr. Sabir is absolutely right. You will tell her कि we will remove the hemithyroid and send the whole thyroid for entire biopsy, and
Yes.
depending upon biopsy report, she might have to undergo a completion of second stage surgery also. ठीक है. So they might also ask you कि what do you want to do as a pre-op measure? तो आपको ideal oblique Hopkins endoscopy also you have to mention what to see. First is to see whether the bilateral cords are mobile or not. Second, you can see whether glottic chink is adequate or not, or whether there is retrocellular extension is too much or not. So these 2-3 points, and fourth obviously the medical legal purpose के लिए आपका होता है. Now, moving ahead, you have planned the patient for thyroid surgery. In thyroid surgery, what are the 2 nerves that you have to take care of?
Sir, recurrent laryngeal nerve and external branch of superior laryngeal.
Now, second question from these nerves only. In how will you identify these nerves? Try answering it.
Sir, external branch of superior laryngeal is identified in Jones triangle.
Okay.
And,
please remember the
we can-
boundaries of Jones triangle. Very important.
Yes,
Okay.
sir. Yes,
So
sir.
draw the diagram and practice of Jones and Bayer's triangle.
Bayer's
Okay.
triangle.
Now come to RLN. How will you identify RLN?
Sir, in Bayer's triangle.
Boundaries and all you have to remember. All triangles, all boundaries should be remembered by heart. ठीक है. I'm not I'll not bore you up. ठीक है. And ठीक है. ये आपका हो गया. Then you plan a surgery for the patient. Do you put drain for the patient?
Yes, sir.
At your setting, do you put drain?
Yes,
Okay.
we put.
Supposedly in the post-op, you get a call that there is a rapid filling of drain. What is the most common site of bleeding normally in these kind of circumstances?
Sir, internal jugular vein.
IJV कहाँ घुस गया? ठीक है. IJV तो we don't touch only ना. Superior
Sir,
thyroid.
superior thyroid.
ठीक है. IJV तो we don't touch only ना भाई. IJV ऐसा PG candidate तो कहाँ touch करेंगे? ठीक है. So superior thyroid. So normally what happens कि this is a place where commonly the slippage of ligature occurs. So that's why you have to remember about this. Now, second thing you have to mention is about the parathyroids, right? So how will you identify? You remember 4 or 5 points about parathyroid?
Yes, sir. The parathyroid glands are soft and pale yellow in color. And superior parathyroids are most constant, and they are found in the posterior aspect of the thyroid gland, 1 centimeter above the junction of recurrent nerve and inferior thyroid artery. And inferior parathyroid glands are found 1 centimeter below the junction of RLN and inferior thyroid artery. And nowadays we are doing the indocyanine green method of identification of the parathyroid glands.
Okay, good. Okay, so obviously frozen section is the gold standard. So I can add all these points along with 4 points I had compiled, shared it on group. So whatever you told, you can add it into this and make a comprehensive answer for the main exam. Now, supposedly, by mistake, this parathyroids are severed, and you come to know ki galti ho gayi. So, where do you reimplant them? Any option? And any other place apart from sternocleidomastoid? Brachioradialis. Okay. So generally, SCM is in the same incision. People do that. So, and these two names you have to remember, where you can implant. Okay.
So second name क्या है?
Forearm में brachioradialis muscle.
Okay, sir.
Okay. Then next question can come is basically your superior parathyroids and inferior parathyroids. What are the location of these glands? Which of them is more constant? Superior or inferior?
Superior.
Okay. So you have to mention that sir, superior parathyroids are more constant in location. Inferior parathyroid can be mediastinal, superior, inferior, सब कुछ हो सकता है. Then it can come that how will you preserve the blood supply to parathyroids?
By ligating the inferior thyroid artery near to the gland.
Near to the gland. Okay. As close to this your artery, the more the chances of the blood supply to be maintained. Okay. So we have completed till now. Okay. Now after this, you underwent the surgery हो गया पूरा. Surgery बाद you put a drain, you place the patient, post-op में चला गया. When you come for the post-op evening round, what will you what are you looking at the patient? What signs you will look at the patient?
Sir, Shostak sign and carpopedal spasm.
Trizo sign and Shostak sign.
So these are the two named signs that you have to look. And how will the patient complains to you? What will the complaints of patient?
Perioral numbness.
So he will complain. Yes, doctor. So he will give you symptoms
Spasms.
of hypocalcemia. So this will be spasm, tetany, perioral numbness, and tingling. All these things can be there. So you have to remember how to give calcium to the patient, calcium gluconate. That dose you have to remember. Now, second question will be how do you measure corrected calcium for the patient? There's a formula for corrected calcium. I request someone please put it on the group for everyone's benefit. This is important. Corrected calcium. ठीक है? Corrected calcium हमने देख लिया. And normally जो calcium gluconate है, they say that around 10 ml of 10% of calcium gluconate diluted in 100 ml of dextrose or normal saline, and it is given IV over 10 minutes. Okay? And you can repeat it after 1 hour if the symptoms don't resolve. Okay? So okay, we have discussed most of them. Okay, I'm just going through all the Viva questions that we had taken. Okay. So one question I forgot in the examination point. You mentioned about tremors. So how do you see tremors? Where do you see tremors?
Hands. Fingers.
What hands?
Tongue and
tongue actually.
Outstretched hand.
Outstretched hands mention. If you are mentioning the digits, you have to mention this word outstretched hand. And apart from that, you can see it on the uvula. You can see it on the tongue as well. Both of them. Okay. Both of them. Okay. So this is also done. Anything else? Then yes. After that, supposedly, this thing comes out to be malignant. Okay? The biopsy report comes out to be malignant. So then your Viva will shift to another prerogative. Till now, it's like a basic MSc NT Viva, DNB NT Viva. आपका यहाँ पे खत्म हो जाता है. From here, technically, the level of Viva will upgrade. So how will it go? In the example, in the familial history, you said there's no history of any familial malignancy. यहाँ पे you will be asked about MEN syndrome. Okay, so please ratify your MEN 1, MEN 2A, MEN B. It is very important. Multiple endocrine neoplasia is you cannot afford to forget it. till you pass your exam. Okay? So this will start. Then another question will be about the pheochromocytoma. They'll ask you how will you measure, like what is the investigation for pheochromocytoma?
Serum catecholamines.
Anything else?
Vinyl VMA, vinyl mandelic acid.
VMA, vinyl mandelic acid.
Vinyl mandelic
Okay,
acid, urine vinyl.
So these two names you have to remember, catecholamines and this VMA. Both of them are important. ठीक है? And ठीक है. अच्छा, Dr. Saab, do you remember any changes in the AGCC 8? What they have changed till now?
So stage 3 में age of the patient if 45 से 55 हो गया, and stage 3 में more than
urine vinyl mandelic acid.
ठीक है, तो फर्स्ट इज आपका एज आपका बढ़ा दिया, 45 से 55 कर दिया.
and 3A, 3B.
They have mentioned the yes, T3A, T3B कर दिया है. Then neck notes में change किया है, and fourth आपका anaplastic carcinoma में change किया है.
Age.
I've mentioned the screenshot on the group. हाँ.
They have.
हाँ, बोलो. You are right, Doctor. Go ahead. He's not speaking now. ठीक है, that's okay. ठीक है, so remember this thing. And apart from that, and a very common question is, I'll share it again over here also. How will you come to how will you doubt whether the patient is having malignancy based on history, based on examination, and based on imaging. So ठीक है, that also I've shared on group. Please go through it. It is important. इसको this और रट्टाफाई वाला चीज है. There is no दिमाग नहीं लगाना, just remember it. ठीक है, just guys give me 30 seconds more. One more PDF is left. I'll just check. इसमें तो कुछ और नहीं बच रहा है. ठीक है, and then we can discuss. ठीक है, we still have around 5-10 minutes left, है ना? कोई ऐसा?
Sir.
हाँ जी.
Sir, can you please repeat how to preserve the blood supply to the parathyroid gland, sir?
See, how to preserve the blood supply? Basically, the blood supply comes from the inferior thyroid artery, right? So you have to ligate it close to the gland. So one thing is that it will help you in identification of the gland also, and it will help in you can visualize and see whether the blood supply is maintained to the gland. Okay. So these two things are there. Okay. Please guys read about radioactive iodine therapy. Okay. Mainly आपका जो indications है, advantage है, disadvantage है, how will you counsel the patient? ठीक है. Two questions will be there. In the AGCC guideline, they have mentioned about hemithyroidectomy versus total thyroidectomy in early papillary cancer. ठीक है, तो अभी मैं आपको just share करता हूँ इसके बाद PDF. Remember these questions. These all are viva questions, which will be one level up. Once you reach all the discussion, उसके बाद फिर ये सब question आपके आएंगे. If you get stuck up in ultrasound and FNAC only, फिर nobody will ask you these questions. Remember the nodal stages of thyroid malignancy. This is important to you. ठीक है. And apart from that, so yeah, all triangles you have to remember. Remember Cernia classification. Remember Friedman classification too. There are two laws that you have to remember from thyroid. First is the Simon's law. Second is the Wagner and Grossman theory. Okay, these two laws you have to remember. And Pemberton, Quizilo, Cryles, Lahis. Lahis के नाम पे there are few other things also. This one is Lahis traction forceps. There is Lahis retractor. ठीक है. And Kocher's के नाम पे there is Kocher's incision. There is Kocher's retractor. And photo of Dr. Theodore Kocher. ठीक है. And Kocher's test also. Yes. Kocher's test is basically for this Cabal trachea, as Sir had already mentioned. Okay. So I'll share this. There are two PDFs that I will share. One is the previous one, which contains with some OSCEs also. Go through that. And second is only the Viva questions comprising of both the videos that I had shared. Okay. I've tried to mention all the answers also there itself. And this there is you get any confusion, please get back to me. Okay. So Dr. Saab, let's come to the main screen now. Okay. There's last 2-3 days left for your studies, and now we have supposedly 2 days mota left for revision. Please let me know if anything you want in specific. Okay, OSCEs we have discussed lots of OSCEs. It was very good that all of you participated, and I'll say कि जितना previous year का questions था, most of it we've discussed. Two things I would like to mention. See, normally what happens, as in every class, there are I'll say 20-30% of the people who are like volunteering and doing the good work. सब discussion करेंगे, forward करेंगे, that's good. But for the 80% of the people, please keep watching those questions. ठीक है, it shouldn't happen कि group पे discuss हुआ है and you have not seen them also. So then it's a loss for you. ठीक है, even if you don't contribute, that's okay, pretty okay. Like many reasons are there. ठीक है, but many like most of the people have put some of the input कि ये answer हो सकता है, ये नहीं हो सकता, like multiple things they have shared their thoughts. So just go through them. That will help you frame your thoughts accordingly. It shouldn't happen that you are just taken aback. Like I'll say कि I'll not. It's not that the same questions will be repeated, but the questions will be repeated from the same topic itself. The topic won't change. Like we have discussed AFRS, they'll ask you mucor this time. We have discussed papillary carcinoma, they might ask you medullary carcinoma this time. We have discussed omalizumab, they might ask you cetuximab this time. So like similar things are gonna come. Nothing new will be there. And for OSCEs, my again a sincere request to you guys are कि see OSCEs जो होते हैं, they will be in sets of question. All of you will not get 1 to 20 same. ठीक है? So what happens generally, 50%, that is 10 OSCEs, they are like for a average student. You will be able to score. Just remain calm and just a minute. Okay. So just remain calm and keep your mind cool. You will be able to answer 10 questions. Just panic mat karna. Okay. And another 5 questions, they will be little bit difficult. You have to apply your brains. You have to do your brainstorming. ये हो सकता है, ये नहीं हो सकता. The only problematic factor is the time which limits you. है ना? So and remaining 5 questions will be bouncer. Bouncer मतलब बिल्कुल bold, zero. हो सकता है you might not have even heard of it. You will be like यार ये ear का question है, larynx का है, nose का है. Even this kind of doubt can also come to you. So don't worry. ठीक है, even if this kind of also doubt comes कि whether this question is from otology, larynx, what kind of surgery is there, don't worry. You are not a bad student कि तुमने पढ़ाई नहीं किया है. It's not like that. 5 questions will definitely be there for everyone. So don't worry, if you score more than 10-11 questions in your OSCE, you're good to go. More than 50% आराम से आएगा. मोटा हाथ मारना है केफ डिस्कशन में. हाँ बताओ.
सर ये 2 क्लासिफिकेशन आपने बोले, सर्नियर क्लासिफिकेशन और दूसरा
फ्रीडमैन, FREID, फ्रीडमैन क्लासिफिकेशन. ये ले ग्रुप पे डाल दे रहे हैं भाई, एक बार सर्च मार लेंगे. ठीक है, 2-3 जगह है फ्रीडमैन ENT में, इसकी एक जगह नहीं है, टॉन्सिल वगैरह में भी एक जगह आता है ये. ठीक है, so ये हो गया. So and your basic help will come from the long cases and the short cases. If you are able to present, like I'll not say very good, excellent की बात ही नहीं कर रहा हूँ. मोटा basics also you are able to present, you will get 60% marks. 50 to 60% आराम से मिल जाता है. And that 10-20% that you are able to take extra from here, this will help you in any table viva that goes wrong, in any word round that goes wrong, or probably if your kismat is एकदम ही बेकार, like you are able to do only 6-7 OSCEs, तो जो 4-5 OSCE का 5 OSCEs का deficit is coming, that you will cover from the main this part. So keep revising all the long cases on a rotation basis. Keep revising short cases on a